Hi everyone. I will make this a very brief video to review some designations of status for labs based on some things that we've learned in terms of what the nurses see versus what we see. So I have Lieutenant Uhura, and you can see here all of these labs were ordered, right? CBC, iron, free T4, TSH, etc. Well, as we know, the CBC and the iron will probably come back pretty quickly, maybe even the hemoglobin A1C, but the lipid profile and the free T4 and TSH may take a few more days. So what we've learned is, let's say you get some of the lab results back, but not all of them. Then the question is, how do you mark it? So if you mark it as partially received or partially reviewed, very logical. However, if you use those designations, the nurses do not see this as a lab that's still pending that they have to go look for. So if you mark it as partially reviewed or partially received, and you only have, let's say, the CBC and the iron and the hemoglobin A1C back, and you're still waiting for the TSH and the lipid and the free T4, the nurses will not have, it'll fall off of the nurses list, so they will not even know that there's still pending test out there, so they won't know to look for it and go get it. So I know it's kind of crazy, but what we have found is the only way to ensure that we keep this on the nurses list so that they keep looking day after day for the rest of the results is, once you've looked at the results you have, you need to change it back to pending. Okay, so if you switch it back to pending, then it will stay on their radar and they will be able to find the rest of the results when it comes back. So if we go through these, awaiting test action. If you mark it awaiting test action, then that means essentially it's a sign you're telling yourself that you're going to do something with it, but again, it's not on the nurse's radar. The only way to make sure it stays on the nurse's radar is to mark it pending again. And then just to remind everyone, if you mark something reviewed, that means that you've looked at it and you're waiting for the nurses to make a call to the family to let them know what the results are. If it is a mild abnormal, and we're assuming you would send a message and let the nurses know what you're thinking. If it's a normal, then you just mark it reviewed and leave it, because then the nurses are supposed to find that, look at that, contact the family, and then they change it to informed. Remember, informed is only to be used if you yourself inform the family. Complete is the designation we use if it is a test ordered by someone else. So if you're just getting copied on test ordered by endocrinology or anyone else at children's, or for a kid who's in-house, you're going to mark those as complete. Again, remember, partially received, reviewed, informed, all of these are basically not designations that will keep anyone else looking for the results. So if you use these, then you're kind of committing that you yourself are going to be the one looking for the results. We're not really using deferred. No-show is the designation we should use if a patient does not go for the lab test. Canceled is the designation we're going to use if you, as the provider, feel that the test is no longer necessary. So just remember, the key thing is just remember to go, anytime you don't have everything back and you're waiting for more, switch this back to pending so that it'll stay on the nurse's radar. And then when they go into HealthBridge, they know to look for more test results. Because if it is not on their list, even if the test has come back, they don't see it. So anyway, I hope that helps. Thanks so much.